Hello, everybody. My name is Dr. Ian Barwick, and I am a former associate of Dr. Christina Meekum at Healthy Life Chiropractic. And I'm making this video to give you an understanding of what my associate experience was like to help you make the best decision you can. The cliff notes is I had a great experience. I learned a ton in a very short amount of time about pretty much everything between x-rays, patient care, corrective care, giving financials and all that stuff that you need to be a successful chiropractor, but you only are taught a fraction in school. In short, I would definitely do it again if I had the choice. So I want to start by the training process. So I was hired, and I had a cursory working knowledge of NUCCA and upper cervical chiropractic, but that isn't always necessary. Dr. Meekum has trained people who have no knowledge of upper cervical chiropractic care, let alone NUCCA, and they've done a great job. So we started by training me how to adjust to people and all the steps that it takes to make a good NUCCA adjustment, and what all of their systems are to learn about vectors and everything like that. And to set your body in the right position, deliver the proper vector and the proper adjustment for the patients. After a short training period, to make sure that you're good enough, you start by adjusting the maintenance patients, the ones who have been there for a decade, who have a solid vector, no acute conditions they're dealing with, ones that are kind of safe for you to adjust. And then as you progress and become more proficient in your adjusting, you'll be allowed to adjust more difficult cases. Concurrently with learning the patient care, you will have weekly meetings where you learn about the other stuff about patient care, patient communication, how to give good consultations in day ones, how to give good reports and financials with ease and not, fumbling through the numbers and getting all nervous. So anyway, you do all of that through role play, and it's fairly intensive, every week pretty much. And as much as there were times where I was not super keen on it, Dr. Meekum will know, I am super glad that it was as intensive as it was, because when my wife, Dr. Ashley Gonzalez, and I, when we opened up our own practice earlier this year, because I had the training and the knowledge of how to communicate with patients, I was actually able to train Ashley and give her a head start when she was starting to take her own patients and do her reports, because there's a lot of finesse to talking to patients, and if you're not kind of trained on what works, then you just waste a lot of time and potentially lose a lot of money just trying to fumble through the right words and find the ones that work. With training, Dr. Meekum already gives you the words that work and you just have to learn them and implement them in a way that makes sense for you. It's super helpful, super helpful. In addition to so that was the adjusting training, and then the patient management and communication training, and then there's the x-ray training. At Healthy Life, you will take a lot of x-rays, and not because you take an excessive amount, but because the office sees a lot of patients. They're super blessed, and because there's a lot of patients, you do end up taking a lot of x-rays, and so you get very good at taking x-rays quick, and that saves a lot of time, especially when you go on to your next practice. If you go on to your next practice, it saves a lot of wasted time, because you kind of are forced to develop a system to make things as streamlined as possible, so you don't really have to think. It's just one x-ray to the next, and then to the next, and to the next. Even with the NUCCA films, you have like checklists of things you need to look for to make sure that you're pretty sure this picture is going to turn out right, and you know what to look for very quickly. It saves a ton of time and a ton of confidence when you do open up your own practice. Again, if you do open up your own practice, when you start taking x-rays, it's just that next level of, all right, I already know what to do, and I don't have to fumble. Again, came way in handy when we opened our practice. I was confident taking x-rays, Ashley was not, so for the first few weeks, I was taking a lot of her patients' x-rays because she wasn't confident, and she was kind of watching me. I was coaching her through it. Again, something that you only get through experience, and at Healthy Life, you get a lot of really good experience that way. The office itself is located on Clement Street, which is arguably one of the coolest neighborhoods in San Francisco, and it's only a short distance from the Presidio, which is the Golden Gate Bridge, kind of the whole National Monument National Park area. Probably the prettiest place in San Francisco, I think. And on Clement Street, there's a ton of restaurants, really good, like small business restaurants that you can try. And I wish I did this while I was still there, is trying a new restaurant every week just to sample it all. And you probably still wouldn't run out of new restaurants after a year. There's some free parking about a 10-minute walk away from the office, and then there's metered parking around the office. That was probably one of the, unfortunately, more difficult things to manage, but it is manageable and it wasn't that difficult. The office atmosphere in itself was one of gratitude. The patients are super thankful for what Healthy Life does and has done for them, and what the docs do for them. And so they show you appreciation, not by just paying you, but they also will bring in sweet treats and gifts, and especially during the holidays. Overall, Dr. Meekum does expect a lot out of her associates. There's a lot of work, and she doesn't waste any time getting her docs up to speed, integrated into the team, and really catapulting their growth, and oftentimes a lot faster than you think is possible, which can be uncomfortable at times, but overall, necessary, on the flip side, she compensates you well for it. She knows how much work it is, and she shows her gratitude. I honestly could not imagine how much harder it would have been to start my own practice had I not associated at Healthy Life first. There's so many small things, nuances that you don't learn and you don't think about until you have someone who's coaching you, who's been there, who's started from ground zero and knows this is what it takes, this is what has worked, and this is what hasn't. And then she teaches it to you. So I do it. It's worth it. If you have any other questions for me, you can find me on Instagram at bartown93, or you can find me on Facebook. I'm always open to chat. Cheers.